If you are past 65, one common medical test can start more trouble than it prevents. Some tests sound smart only because they are familiar. A normal yearly habit can quietly become the wrong move as your body and goals change. If you do not know which tests to question now, you may give away peace, time, and even health. Before we get into this, please stay close to this channel by subscribing now. A lot of people never see the next video unless they are subscribed, and this topic is too important to miss. I want to keep bringing you clear, calm advice that helps you make safer choices. Now let me say one very important thing right away. I'm not talking about tests you need because of pain, bleeding, weight loss, shortness of breath, or a new symptom that worries you. I am talking about routine tests done just because someone says, "We always do this," or because a scary ad tells you more testing must be better. After 65, the goal is not to collect more tests. The goal is to choose the right tests at the right time for the right reason. That shift matters because aging changes the math. A test is not just a picture or a blood draw. A test can lead to another test, then a biopsy, then a procedure, then a side effect, then worry that steals your sleep. In younger years, that chain may make sense more often. In older years, especially if you already live with heart disease, diabetes, kidney trouble, or balance issues, one extra step can push your body harder than it needs to go. So in this video, I am counting down 5 medical tests I would never get after 65, unless there was a very clear reason. You may be surprised by what is on this list. Some of these are sold as peace of mind. But peace built on the wrong test is like building a porch on soft mud. It looks solid for a minute, then the boards start to sink. Let's start with number 5. Number 5 is the full-body CT scan done just to look for hidden problems when you feel fine. This matters because a scan like that is a giant fishing net thrown into a pond full of harmless shadows, tiny spots, old scars, and things that look scary but mean nothing. When a test is that wide, it often catches questions, not answers. And once a question appears on a report, it can be very hard to ignore. Picture this. You pay for a scan because the ad says early detection saves lives and you want to stay ahead of trouble. The scan finds a tiny spot on the lung, a cyst on the kidney, and a small bump on the adrenal gland. You feel fine, but now your month is full of repeat scans and nervous waiting. A simple action you can start today is this. If anyone offers you a full body scan, ask, "What problem are we looking for and how will this result change what I do next week?" A full body CT scan uses radiation. Radiation is a form of energy used to create the picture. One scan does not mean disaster, but it is not a free pass either. More important than the radiation, though, is the false alarm problem. A false alarm means the test suggests something may be wrong when nothing serious is actually there. Older bodies carry more harmless wear and tear, so the chance of finding little things rises with age. You have probably seen this in regular life. Open an old attic and you will find boxes, dust stains, and marks on the wood. Most of them do not mean the house is falling down. They just show that the house has lived. Your body is the same. A scan may notice old healed changes, tiny nodules, mild joint wear, and other common findings that have been sitting there quietly for years. But once a report names them, fear steps into the room. Then comes the cascade. A cascade means one thing leads to another thing, and then another. A spot becomes a repeat scan. The repeat scan leads to contrast dye, which is a special liquid used to make pictures clearer. That dye can be hard on some kidneys. Then maybe you get a biopsy, which means taking a small piece of tissue to look at closely. Each step adds risk, stress, cost, and more time spent as a patient instead of a person living your life. Let me ask you something in the comments. Have you ever had a test done for reassurance that ended up creating more worry instead? If yes, tell me what kind of test it was, because your story may help someone else slow down before saying yes too fast. There are times when CT scans are very useful. If you have symptoms, if your doctor is checking a known problem, or if you meet strict screening rules for something like lung cancer because of a smoking history, that is different. The key idea is purpose. A good test answers a real question. A bad test creates 10 new questions you never needed. After 65, you want fewer fishing expeditions and more clear reasons. Now let's go to number 4, and this one catches a lot of good people. Number 4 is a carotid artery ultrasound when you have no stroke symptoms and no clear reason to look. The carotid arteries are the big blood vessels in your neck that carry blood to your brain. This matters because looking at them without a good reason can be like checking every inch of garden hose for a weak spot when the water is flowing just fine. You may find a little narrowing, but that does not always mean it is the cause of anything or needs to be fixed. Picture this. Imagine someone hears about stroke risk and gets scared after a friend has one. They ask for a neck artery scan, even though they have had no warning signs at all. The test shows mild buildup, and suddenly they feel as if a stroke is waiting around the corner. The action step here is simple. If a neck artery test is suggested, ask whether you have symptoms that make the test likely to help, not just make you nervous. The reason this matters is that a small amount of plaque is common with age. Plaque means fatty buildup inside the artery wall. That sounds frightening, but not every bit of plaque is a ticking clock. When you screen large groups of people who feel fine, you often find mild narrowing that does not need surgery. But once narrowing is found, many people feel pressure to chase it with more visits, more scans, and sometimes procedures that carry their own dangers. And those dangers are not small. Procedures on the carotid artery can sometimes lead to stroke, bleeding, or other serious problems. That does not mean no one should ever have them. It means they should be used carefully for the right person at the right time. If you have had sudden weakness on one side, trouble speaking, sudden vision loss, or a mini stroke, that is a whole different story. But if you feel well and someone is offering this as a routine check just because of age, I would step back first. Think of it like this. If your roof is leaking, you inspect the roof. If the roof is dry and solid, you do not start ripping off shingles just because roofs can leak one day. The smarter move is to work on the things that clearly lower stroke risk for most older adults. That means keeping blood pressure under control, not smoking, moving your body, taking the right medicines if your doctor prescribed them, and keeping blood sugar in a healthy range if you have diabetes. Those steps protect you more reliably than scanning at random. If this point is helping you, tap like for one reason only. It helps another older viewer who is worried about stroke find calm, useful guidance instead of fear-based advice. That small click can put this message in front of someone who truly needs it tonight. Aging well is often less about hunting hidden danger and more about managing the danger we already understand. Blood pressure is a great example. High blood pressure can damage arteries over time, yet many people focus on a fancy test instead of the daily habit that matters more. That is like ignoring a dripping faucet while paying for a camera to look inside the wall. After 65, clear basics beat vague screening more often than people realize. Now let's move to number 3, and this is one many people ask for after a friend has a heart scare. Number 3 is a routine heart stress test or resting ECG when you have no symptoms and just want reassurance. An ECG is a simple tracing of your heart's electrical activity. A stress test checks how your heart works while walking on a treadmill or while medicine makes the heart work harder. This matters because these tests can look powerful, but in people who feel fine, they often act like smoke detectors placed too close to the toaster. They may go off, but not because the house is on fire. Picture this. You feel okay, but you are turning 70 and you think a yearly heart test sounds wise. The result comes back a little abnormal. Now you are told you may need a scan, maybe a catheter test, maybe more follow-up, even though nothing in your daily life had changed. Your action step is this. If you have no chest pain, no unusual shortness of breath, no fainting, and no new drop in stamina, ask whether better blood pressure control, walking, and cholesterol treatment would protect you more than a screening heart test. This point surprises many people because heart disease is common, and common problems make us want to test harder. But common does not always mean screen everyone. A screening test only makes sense when it improves decisions in a clear way. If a test mostly sends healthy-feeling people into a maze of extra steps, it may not help. Older adults can have harmless changes on an ECG. The machine may label them, and once that label sticks, the next person who reads the chart may react to the label more than the person sitting in front of them. Then there is the follow-up problem. One abnormal line on paper can lead to imaging, dye, radiation, and procedures. A catheter test means a doctor threads a thin tube into a blood vessel to look closely at the heart. That can be life-saving when you truly need it. But when it grows out of a screening test in someone with no symptoms, you have to ask whether the road makes sense. Every road has potholes. Bleeding, kidney strain, allergic reaction, and worry are real potholes. The better question after 65 is often not, should I test my heart more, but how well am I protecting my heart every day? Do you walk most days? Do you sleep enough? Do you know your blood pressure? Are you taking medicines the way they were prescribed? Are you eating in a way that supports your arteries instead of inflaming them? Inflammation means irritation inside the body. Small daily choices often beat flashy screening in a quiet but powerful way. Be honest with me in the comments. On a scale from 1 to 10, how strong do you feel your daily heart habits are right now? 1 means I know I need to start over, and 10 means I am really staying on top of it. Now, if you do have symptoms, that changes everything. Chest pressure, jaw pain with walking, new shortness of breath, fainting, racing heart spells, or swelling can all be reasons your doctor may want testing. So again, I am not against heart tests. I am against using them like lucky charms. A lucky charm feels good in your pocket, but it does not steer the car. Smart choices steer the car. And that brings us to number 2. But before we go there, I want to pause for a quick and honest reminder. Everything in this video is general information, not personal medical advice. Please talk with your own doctor before changing a test schedule, especially if you take medicine every day or live with a long-term condition. Your full health story matters more than any short video ever could. Use this to start a better conversation, not to replace one. Number 2 is a routine PSA blood test after 70 when it is being done automatically instead of after a real discussion. PSA is a blood test linked to the prostate, a gland men have below the bladder. This matters because a rising PSA can point to cancer, but it can also rise for other reasons, and not every prostate cancer is dangerous. Some grow so slowly that they never cause trouble, especially later in life. That means the test can pull you into a battle you may never have needed to fight. Picture this. Imagine someone feels well, urinates about the same as always, and goes in for a regular visit. A PSA is added without much talk. It comes back high, then comes repeat blood work, then a biopsy, then days of dread, and maybe treatment for a cancer that would never have harmed him. The simple step to start today is this. If you are 70 or older, ask your doctor, what is the chance this test helps me more than it harms me based on my age, health, and values? This is where many men feel torn. They hear, catch cancer early, and of course that sounds wise. But there is another truth. Finding cancer early only helps if the cancer is the kind that needed finding, and the treatment improves your life more than it harms it. Treatment can bring urine leakage, trouble with erections, bowel problems, and months of stress. Urine leakage means loss of bladder control. Those are not small side effects, so the decision should never be quick or automatic. Your overall health matters here more than many people realize. A healthy, active man in his late 60s may see this test very differently from a man in his 80s with heart failure, kidney disease, and trouble walking across the room. Life expectancy matters too, but I want to say that gently. This is not about giving up. It is about choosing care that truly serves you. The goal is not to find every possible slow-growing problem. The goal is to protect the years you are most likely to live. And let me add this because it is important. If you already have prostate cancer, if your doctor is tracking a known issue, or if you have symptoms that need evaluation, that is a different situation. A routine screening test and a follow-up test are not the same thing. This is about the habit of yearly automatic testing without a real talk. Older men deserve a real talk, not a checkbox, not a reflex. A real conversation about benefit, harm, and what matters most to them. Please share this video with one man in your life who tends to say yes to every test because he thinks more testing always means better care. A brother, husband, neighbor, church friend, or golfing buddy may need to hear this exact point before his next appointment. Good medicine should fit the person, not just the calendar. That is true for PSA, and it is also true for the final test on this list. This last one may surprise you because it has saved many lives. But after a certain age, and in some people much sooner than others, doing it by habit instead of by judgment can do more harm than good. Here comes number one. Number one is a routine colonoscopy in older age just because the reminder card says it is time. A colonoscopy is the camera test used to look inside the colon. This matters because a useful test can become a rough test when age, frailty, past normal results, or other illnesses change the balance. It is like insisting on climbing a tall ladder to clean one small leaf from the gutter when your legs are shaky, and the gutter may already be clear. The job may still matter, but the method and timing must fit the body doing it. Picture this. You had normal colonoscopies for years and no new bowel symptoms. Now you are older, you take several medicines, the prep wipes you out, and balance is not what it used to be, yet the appointment gets booked almost by habit. The action to start today is simple. Ask whether your age, your past screening history, and your overall health still make this test the best choice, or whether it is reasonable to stop or choose another plan. Why do I say this so strongly? Because colonoscopy is not just a quick peek. There is bowel prep, and the prep can be hard. Bowel prep means drinking strong medicine to empty the colon. It can leave you weak, dizzy, and dehydrated. Dehydrated means your body does not have enough fluid. For some older adults, especially those with kidney disease, heart problems, or balance trouble, the prep can be tougher than people expect. Then there is the sedation, which is medicine used to make you sleepy during the test. That can hit older bodies differently too. There is also the simple truth that not every older adult gets the same benefit from repeated screening. If you are in good health and have a reason to keep screening, that may make sense. If you are well into your late 70s or 80s, have other major illnesses, or have already had normal results, the payoff may shrink while the hassle and risk rise. That is not fear-talking, that is common sense. A screening test should offer enough likely benefit to justify what you go through to get it. If the likely benefit becomes small, it is fair to question the habit. People sometimes feel guilty for even asking. They worry it sounds lazy or careless. It does not. Asking good questions is one of the smartest health habits you can have. You are not refusing care. You are asking for care that fits your stage of life. There is a big difference. Good doctors should welcome that discussion. In fact, they often wish more patients would ask it, because too many tests get repeated simply because no one stopped to revisit the plan. If you want to stay with us for next week's topic on what blood pressure changes after 70 should never be ignored, and which ones usually do not mean danger, subscribe now and turn on the bell. That way, the next lesson shows up when it matters instead of getting buried and missed. I also want you to notice something bigger running through all 5 of these tests. None of them are bad in every person. The problem is mindless testing. Mindless testing says yes before it asks why. Wise testing asks 4 simple questions. What are we looking for? How likely are we to find something that matters? What happens if the test is positive? And will the answer truly change my care in a way that helps me live better, not just live more worried? That little set of questions can protect you from so much trouble. It slows the room down. It moves you from passive patient to active partner. And after 65, that shift can be life-changing. Because the older you get, the easier it is for the medical system to treat you like a schedule instead of a person. You are due for this, time for that. Repeat this again. But your body is not a checklist. Your life is not a factory line. Let me ask you something personal. Which one of these 5 tests surprised you the most today? Tell me the one you used to trust without question, because I read those comments and they help shape what we talk about next. So let's bring this home in the simplest way possible. The first action is not to cancel everything. The first action is to stop saying yes automatically. At your next visit, bring a short list of any routine tests you have been getting. Then ask, do I still need this at my age and in my condition, and what happens if I skip it? That one question can save you from unnecessary scans, referrals, prep, needles, and long nights of fear. The second action is to focus on the quiet protectors that matter more than flashy testing for many older adults. Control blood pressure. Walk most days if you are able. Take medicines correctly. Sleep well. Keep follow-up visits for real problems you already know about. Speak up fast when you get a new symptom that is truly different for you. Those habits may look plain, but plain habits often do the heavy lifting. A sturdy roof usually comes from steady care, not from buying more ladders. And if this conversation gave you a new way to think about your next doctor visit, tap like. That helps another older adult find this video before they agree to a test they do not fully understand. Sometimes the biggest favor you can do for a stranger is help calm them down before they get swept into the wrong decision. If you want more simple, honest guidance like this, subscribe and turn on the notification bell so you do not miss what we cover next. And please send this video to one person you care about, who is over 65 and tends to trust every routine test without asking questions. You still have so much power in your health choices, and the right question at the right moment can protect your peace, your strength, and your future. You are not too old to be careful, and you are not too late to make smarter choices starting today.